next one, Palmar Fasciitis. Palmar Fasciitis is right in the palm area, and the palm can be more contracted, so the fascia in that area. So that's why we want to do a lot more broadening in that area as much as possible. So some people hold here and even do a little bit of knuckling with your knuckles, just going back and forth in circular motions, or just back and forth like this, just to help relax it first, and then you can do some broadening with the palm area. So palmar fasciitis, sometimes the person's palm is going to be more contracted, especially if they use computer all day long, or if they're a mechanic or a carpenter, they're gripping onto tools so tight. That's why you need to elongate those muscles in that area. So there's a muscle, it's called the palmaris longus. It starts up the medial epicondyle region, it goes down to right to the palm. So that's the area, if it's muscle related, we're going to stretch that out. Another one is just called pinky wrap, spread it, pinky, wrap both fingers like this and stretch out that area for that. But most people love this kind of technique to help relieve those kind of things. Another option, here, and here. So again, the middle finger is sticking up in this area, 2 fingers in here, 1 finger in here, 1 finger. And it's just a different way of stretching out that area too, for anything with palmar problems. Another option is you can interlock the fingers, and you can stretch out the palm area. So again, ask the client too what kind of things work for them, what kind of things they like. And those are the kind of things, if they come back the next time, you want to make sure you documented those, so you make sure you perform those kind of techniques, so you keep that client as much as you can then. So again, just broadening that area works, and you can even use your knuckle too, over your thumb. And you can just give a little pull. And with the stretch, what we're going to do is you're going to compress here, press and hold on to the forearm, and pull the wrist. You're going to traction it, and then you can extend it too, so you can get a better stretch. Or you can just do a basic stretch too, like that. So bring like this and stretch it out. But again, if they have carpal tunnel syndrome, just work at it slow, and just the more communication, the better. So if they're ever tingling during the sensation, during the treatment, perform more relaxation kind of techniques to start with, and eventually get a little bit deeper as it goes on. But the first time dealing with that person with carpal tunnel problems, it's a good idea to kind of do like a deeper Swedish, not go all out deep tissue. Even if they've had deep tissue in the past, your pressure might be different than other people's pressure. So that's why just ask them those kind of things as much as you can then.